Very warm welcome to all of you. Good evening, everyone. My name is Dr. Meera, and I am your host today. So, we welcomes you in our next Q&A series. And as you all know, functional medicine clinic is working towards identifying root cause treatment. And we all are under the tsunami of chronic disease now. So, people are taking medication but still struggling from the symptoms and fatigue and everything. So without a delay, let's welcome Dr. Ashwani Garg. He is the co-founder of Functional Medicine Clinic and co-founder of the Indian Functional Medicine Association. So without a delay, let's start our Q&A session. So very warm welcome, Dr. Ashwani Garg.
Thank you, Dr. Meera. Thanks so much. And thank you, everyone.
So we have a couple of questions from the patient. So first and very common question is that, so after we complete a treatment and protocol, how to maintain the healthy balance to avoid toxicities and infection again?
That's a very, very important, relevant question now.
Yeah.
We are living in a toxic world and a stressful life. Now, if stress is there, immune system will get downregulated. Infections can regrow. If toxins are there in the environment, typically they will tend to get in and start depositing. Okay. So once we have done the heavy lifting, in the sense 3, 6 months, 9 months, we have done the cleanup, we have built the immune system, etc., etc. Then first priority is getting a lot of sunlight. Second priority is making sure body is hydrated, drinking enough good quality structured water. Third priority is sleeping at the right time and in darkness. Next, making sure that we are eating good food. Broadly, reducing carbs, reducing refined things, reducing hybrid foods, etc. And whatever we are eating, we should be able to digest. Now, if these are met, then probably every 6 months we can do a blood work to keep a check where things are going on. If things are stable, then we continue what we are doing. It's enough for us. If let's say we're getting into deficiencies or we are piling up any infections, then we can keep optimizing. We don't have to do the whole lot of things, at least some basic work to ensure nutrition is there, to ensure we are detoxifying. So whatever supplementation, whatever protocols are required, probably once a 6 month, do it for 3 months, if at all required, and keep looking at it. Once, 2 times a year, I think it's a good idea to keep looking at markers so that we keep ourselves healthy and we try to avoid anything which might come in the future.
Yes, sir. Great. Okay. So another question is regarding diabetes, type 1 diabetes. And can beta cells in the pancreas regenerate? Can functional medicine approach help in the type 1 diabetes?
Okay, so there are 2 problems in type 1 diabetes. One is a immune system issue. One is a pancreatic function has reduced. Now, functional medicines can certainly help with the immune system problem so that the body doesn't get attacked, come under attack to any other organ also. Now, pancreas, unfortunately, taken a toll. We don't want other organs to be getting under attack. That is one. Now, if we early on diagnose that problem, that let's say pancreatic, it's if early on we get to know the symptoms or the problem, probably 20% of the pancreas is left, 30% of the pancreas is left, 10% of the pancreas is left. We can try saving whatever is left. That is the first priority. Now, research is saying when conditions are not so good in the body, beta cells can turn into alpha cells. And if we return the conditions right in the body, means environment is good, inflammation is less, nutrition is good, then alpha cell can turn back into beta cell once again, but then we don't know how much it will happen. So we will still not say that regeneration is possible or not possible, but at least immune system can become healthy. Another thing that typically also happens, type 1 diabetes, there's certainly insulin low is one problem, but there are also resistance of insulin developing when we keep injecting from outside. Even in the presence of insulin injections taken, blood sugar still keep high over a period of time. Then functional medicine can still help to keep the insulin dosing bare minimum, whatever minimum is required, plus optimal blood sugar levels and HbA1c levels to be maintained.
Right, sir. So we should prevent the preventable. Early diagnosis is necessary. So another question is related to this insulin resistance. And also I would like to ask, that is also my question, why does high insulin level show the normal HbA1c? If HbA1c is normal and even then insulin resistance is high, why this is happening?
So let's say the precursor, pre-marker of diabetes is high insulin. Type 2 diabetes, before somebody has actually became diabetic, the first thing for type 2 diabetes will come to know that insulin is keeping high. Okay, now why insulin is keeping high? These people have insulin resistance. Now, why do we have insulin resistance? Because the metabolic machinery, which is the mitochondria, that is getting bad. It's like engines in the body, in the cells, are not optimally functioning. So they're not consuming enough fuel, which is glucose. That is why body want to ensure that glucose keep going into the cells. So body will start rising up the insulin initially. Then when that high insulin is not able to do the job because metabolic function is increasing, then sugar start going up. So if we improve the engines, which is the mitochondria, then metabolic function, fuel consumption, sugar consumption will increase, energy production will increase, and insulin will drop, and blood sugars will drop.
Thank you, sir. Yeah. So another question is related to the ASD condition, as we are dealing with the children with the spectrum. So one common question one parent is asking, like, should we treat autistic children like other kid, or this is the different kid, or how to deal with the autistic child?
So now, first of all, we have to understand autism is a disease in the body, which is manifesting as poor behavior, poor abilities of the brain, poor sociability, etc., etc. These are just the pure outcomes of the disease in the body, right? So yes, these children with autism, they're already dealing with the disease in the body. They have a lot of trouble already at their hand. So at least we should be trying to be nice with them. We don't want to push hard on them. We don't want to set a lot of expectations from them. Because if you pressurize them so hard, they get more stressed. They get more stressed, cortisol will go high. If cortisol will go high, the immune system will get down regulated. They will already have a lot of infections. They will grow more infection and disease can progress. Okay.
So extra care, yeah.
So we have to deal with them with nicely. The behaviors of an autistic or ASD child is not, they are doing it deliberately. It is stemming from the disease in their body. So we have to fix the disease from the body. So the behavior start regressing away.
Okay, sir. Yeah. Okay. So another question is related to the fatty liver. So one patient is asking, can functional medicine approach help me with the fatty liver, and what kind of treatments are available for the fatty liver?
So basically, liver is an organ which is there to detox our body. So whatever we are eating, it has to pass through the liver. Okay. Now, liver will see what is not required. It'll start taking it out. Now, today people are getting a lot of this non-alcoholic fatty liver. Without drinking a lot of alcohol, they get liver problems and cirrhosis and all of that. So one of the reason is the amount of drugs we are intaking. That can lead to the problem. Until we remove the causative, problem will not go. So if we are unnecessarily taking too many chemicals into our life, we need to reduce. That's one. Major part of the problem of fatty liver that we are seeing is the poor digestive health. When intestines will have a lot of infections, and these infections will produce a lot of toxic metabolites, they will poison the liver. Now, one of the toxic metabolite of infection in the intestine is alcohol. So this is called microbrewery syndrome, which means we take sugar, we take white rice, and we convert this sugar and white rice and all the refined things into alcohol. So without drinking alcohol, we are poisoning our liver. So how functional medicine will help? We will find out what infection is there, what toxicity is there, what deficiency is there, and accordingly we fix your diet, we fix your lifestyle, we clean the infection, we nourish the body. Slowly, gradually liver will start functioning normal and size will reduce to normal.
Yeah, sir. Okay. Thanks for the insights. Another, it's a very common question. How to lose weight naturally? Is it possible to lose weight?
Okay, now anybody who's overweight, there's a pathology behind it. It's not that I am intaking more food, that is why I'm increasing. That could be one of the reasons. If I am unnecessarily eating, I might put on weight. But a lot of people, they don't even eat so much, they're still putting on weight. So one of the reason is inflammation, or a lot of time we see autoimmunity is there in their body, right? Second reason, like I said, is a metabolic disorder. Metabolic disorder means mitochondria is not healthy, right? So engines are not healthy. If your engine is not healthy, it will not consume the fuel. If fuel is not consumed, it will keep high and you keep putting on weight. So we stabilize the immune system, we stabilize the mitochondria, improve the mitochondria, and you start reducing weight. Yes. Can you do it yourself? At least the basic. Make sure you're getting a lot of sunlight. Make sure you're eating 2 meals a day, intermittent fasting. Make sure reduce carbs. Make sure gut is moving, it's not constipated. Okay. Basic nutrients like B vitamins, vitamin D, magnesium, zinc, and proteins are enough in the body. You sleep at right time. 10 o'clock to 10:30, you go to sleep. You sleep for 6 hours, 7 hours, whatever your body needs, but sleeping at the right time. So this is the bare minimum hydration. If you do bare minimum, you might start losing weight without doing anything. But if there is a pathology going on, some infection is going on, some toxicity is going on, mitochondria is not doing okay, then we might have to intervene and support the body come out of the problem.
Yeah. So we need to work upon the root cause rather than the losing weight or gaining weight. So weight gain or weight loss is the byproduct once we heal the pathology from inside. So another patient in the chat asking how to increase the weight. So yeah, the same approach, I think. We need to treat the root cause. And weight gain or
Yes.
weight loss is the byproduct if we heal the pathology from inside. Okay.
A lot of
Yeah.
people with willing to gain weight, this digestion is bad. They
Correct.
want to gain weight, but they don't want to wait till their digestion gets better. Doesn't work like that.
Yes.
Okay.
Yes.
What you eat should become you. For that, your digestive fire has to be enough. Your microbiome balance has to be good, so that food becomes you.
Very true. Yeah, sir. Okay. So someone is asking like, can if we experiencing continuous fatigue, low energy, constipation, so how to deal with that? Our supplements will help, or what kind of approach if the continuous fatigue is there?
Right. So there are two parts of the problem. One is low energy and fatigue. One is constipation. So low energy and fatigue is a metabolic disorder. Every cell will have 5,000 to 15,000 of mitochondria, depending on which part of the body. Brain has the highest, then comes the uh, your heart and all of that. Okay. Now, if quality and quantity and size of the mitochondria has reduced, then energy production will reduce. How much energy? What is affecting the health of the mitochondria? If you don't get sunlight, metabolic trigger is missing. If your hydration is not there, biochemical reactions will not happen in the mitochondria. If you're low on nutrition, body doesn't get what it wants to repair the mitochondria, to regenerate uh, regeneration of the mitochondria. If you're constipated, means you're not taking the toxins out of the body. The toxins can go in, they can poison the mitochondria. So this is very, very basic. If you want to improve the energy and fatigue, you have to improve the mitochondria. For that, you have to improve sunlight, darkness after sunset, hydration, food, and nutrition, etc. Now, why constipation? Constipation against two, three major reasons. One, we don't have enough fiber in the diet. Another one, we don't have healthy stool forming microbes in the gut. That means we have missing healthy microbes, more have pathogenic microbes. Our abdominal muscles are weak. Our intestinal muscles are weak. Vitamin D deficiency, magnesium deficiency, for example. So the strength of the intestines can, so peristaltic activity can come down, or some infections in the intestine can also slow down the peristaltic activity. So fiber, infection, peristalsis, abdominal muscles, lack of nutrients, intestinal wall strength, all of that could be at play causing constipation. So we need to know what is there, and accordingly we need to work upon that.
Right, sir. Okay. So yeah, the next question is regarding AST, and parent want to ask, like, if my child is not cooperating with the diet and supplements, then if the child is picky eater, then what is the next, like?
Now let's understand, why do we have a child, why the child is picky eater in the first place. First comes the taste bud. If zinc is low or other nutrients are low, taste buds are not fully developed, then child can be picky eater. Second, kind of microbes we have, kind of food we will ask for. If I have fungal infections in me, I will ask for more sugars, I will ask for more carbs, which is not good for autistic or ASD children. So if we have to make the improvement, even in the pickiness, we have to change the microbiome to a healthy microbiome. We have to nourish the body so that taste buds can become better. So you have to start making a change. I'm telling you, a lot of people come to us, they say, my child only drinking milk, my child only drinking this or that.
Yes, sir.
As you start, see, interestingly, child is a young body. They're not so fixed up like adults like us. So 3-4 weeks, you try hard, they get on track. Okay. But it takes time, it takes effort, it takes patience. You really has to give it a shot. And I'm telling you, once they get on track, it's easy for them to be on the track. But and another thing very, very interesting is, we all humans have an instinct of hunger. If I don't eat for one time, two time, three times, then whatever nonsense given to me, I will eat. I will not choose what is tasty for me. But if I have 10 options with me, then I'll only look for, when I don't have the ability to judge what is good for me, bad for me, I will only look for the things which are tasty, which my senses are asking for. But if I only have one option in front of me, how many days I can be hungry, right? So I keep telling them that some parents agree and they do that, and the child start eating what they need to be eating.
Yeah, and also we have seen lots of success stories. Those parents are able to maintain this diet protocol and working with us. Yeah. Okay. So, yeah, would you like to say regarding this PCOS, because largely women are suffering from this PCOS nowadays. So, what are the reasons and how to deal with? Because nowadays it's very common with the women. Yeah.
So PCOS is a very fairly simple problem, again a metabolic disorder. So let's understand from an energy standpoint of view. If a woman has to get pregnant, she should have enough energy in the body. Now, when she has a metabolic disorder, high insulin is there, low energy production is there, then body is not interested in fertilization. Body is not interested in reproduction, because giving a life needs a lot of energy. So if we improve your insulin resistance, we improve your metabolic activity, we improve your energy production by changing diet, lifestyle, nourishment, and all of that, then PCOS is just 3-6 months. It's gone. It's gone. It's fairly a very simple game.
Yes, sir. Okay. So soon we will start live Q&A, and those who want to ask questions and discuss with the sir can raise their hand, and we will discuss that live question. Sweta, would you like to ask? Yeah, Sweta is the first one. Yes, Sweta, you can unmute yourself and discuss.
Okay, yeah, thank you, Meera. Thank you so much. Can you hear me? Just to be sure.
Yes, Sweta, we can.
Yes, sir. So I have this question. I'm suspecting that my child has, pans and pandas. So,
Right.
I think he's struggling with some infections which are really like stealth infections.
Right.
And those are causing some sort of autoimmunity and stuff.
Right.
So the question that I have is, like, is it really treatable? And if so, I already have a plan. I'm working with you guys already. So
Right.
I have seen a huge improvement in terms of his gut. But then this infection is throwing us back into
Back.
the caves. So I just want to know, how do we deal with this? I mean, what would be the protocol for something like this?
Okay. So Shweta, now only thing that can protect us is our immune system against most of the infections. Okay, of course we can make use of drugs and herbs and nutrition and all of that, but immune system is very important. Now, what controls the immune system is the microbes in the gut. A lot of these guys have a very poor microbiome balance, and it takes time. Slowly, gradually, we can improve this microbiome balance. Another major problem with these children is uh, their toxin load is quite heavy. That also keeps the immune system down regulated, and infections keep coming back. Another, of course, the nutrition. So these are the basic fundamentals to start with. We have to improve these basic fundamentals by ensuring good diet, lifestyle, microbiome, infection control, all of that. Now, once the baseline is sort of good in the sense that toxins are removed and nourishment is enough and all of that, the next step, if we require, we can start doing peptide therapy. Okay, we can start using certain peptides to support the immune system much faster.
Okay.
That is a very powerful way to stimulate the immune system. Then we can do something called GC-MAP, macrophage activating factor, which is more like a immunotherapy. That is one tool that we have. Okay, so likewise, there are extra tools beyond the basics. But then, even if even a expensive tool has to work, the basic has to be right. If I have to build, I'm building a 13-story building, the basic has to be right. Basics takes a little bit of time to strengthen the basics in the body. On the top of that, we can do exosome therapy, for example. Exosomes are more outcomes of the stem cells. They can also stimulate the immune system, right? So there are stages of where we can do extra work, but once the base is good, diet is good, a lot of sunlight, hydration, basic modulation of the microbiome. So after that, if required, we will we'll do extra things on the top of it. It
Okay.
will, just to answer your question, yes, we will be able to take care of these infections, and as infections will come down, immune system will come down and autoimmunity will be taken care.
Okay, doctor. Just in in addition to the main question, the other question is like, um, do you suggest doing like the antibiotics or steroids, or I don't know if you have heard like this, all the therapies the mainstream medicine suggests. Does it make sense to do that in parallel with, the natural
Mhm.
therapies that you
Right,
do generally?
right.
Does it make sense?
So the
Yeah.
physical therapy, see again, if child is enjoying it, nothing wrong with it. But if we are pressurizing the child and child is not liking it and they don't want to do it and they cry and all that, forcing therapy is not a good idea. Now, antibiotics, short term, steroid, short term, when emergency is there, it's fine, it's good to go. But then long term antibiotic has their own consequences. Uh, so
Right.
rather, if it's not an emergency, we stick to a way which is a little more longer in journey, but will
Mm-hmm.
give us more sustainable results, not a short-term result. We do it, we feel the change, but it comes back, it keep coming back.
Right.
So then we
Right.
build the immune system.
Mm-hmm. Okay, doctor. And one last question. What do you suggest for the tonsils and the adenoids, which are really holding all these, strep infections and other virus infections, which are one of the most important causative factors for these kind of, issues. So what do
These
you
are
suggest? Do you
messengers.
really suggest?
These are messengers. They are not a
Mm-hmm.
problem by itself. Adenoids are not a problem by itself, right? They are messengers. They are collecting the antigens to signal to the immune system. Let's put it that way, right?
Okay.
So they're
Right.
just in a way protecting us, the first layer of defense. Now, removal of that is not a solution, right? We need to build the immune system so that the immune system can fight that. We'll achieve that. It takes time. Okay, these problems are quite hardcore. They take a lot of time, but eventually, very very likely, we should be able to bring the child out of the problem.
Okay, doctor. Yeah, thank you very much for answering all the questions patiently. Yeah, appreciate it. Thank you.
Thank you.
Yeah, thank you. Okay. Second is the Verma. Verma, please unmute and
Yeah, hi, doctor. Am I
Yes, sir.
audible? Yeah, okay. Yeah, so yeah, doctor, can throw a light on, I think you talked about a lot of things, like can talk about like this thyroid issue as well. And I think currently like I have like high TSH with like I think T3 T4 are normal, so I'm trying a few things, but I think I'm not sure how much is working or not.
Okay. Okay.
Yeah.
So, Vermaji, again, conventional thought process and my thought process can be different. So please bear with me. Okay, don't blast me for because I'm differing from your
No.
system. Uh, if T4 is normal, then you are not hypothyroid. Okay, it is only high TSH which is the problem. Now, in many cases, we are seeing if there is an autoimmunity in the body, that is one reason of high TSH. So fixing the diet, lifestyle, removing toxins, nourishment will bring down inflammation and will bring down your TSH normal. Okay. Second is iodine deficiency is another possible causative of high TSH. So ensuring body gets enough iodine, TSH will come down. So it's not about hypothyroidism, it's an inflammation or iodine. If we work on that two aspects, probably TSH will come down. 3-6 months is it can be all good.
Okay, got it. So basically you mean like I think the things which you mentioned at the starting, like sunlight, water, and like eating the like less carb foods, all those things, right? When you mean
Yeah,
like
that is
yeah.
that is the baseline for any health, right?
Okay.
Any whatever health problem we're dealing with, or we just want to be healthy, enough sunlight, enough darkness, both are important. Okay, hydration and good food, both. This is very very key, very key.
And like, can you like explain it more? Like if the body does not have iodine, then it's like is it like how does TSH increase? Like
So I think there is now this is very less talked about. There is something called some molecules which used as iodine transport. So when iodine is low, then TSH goes high, and these helps to make these more vesicles and transport mechanisms to transport iodine to different parts of the system. When it is low, then we have to produce more TSH.
Okay, got it. Yeah, thanks, doctor.
Yeah. So next is the Darshan. Yes. Hello, Darshan. Yeah.
Am I audible?
Yes.
Hi, doctor. So I'm currently on my third month of treatment. I'm currently on active garlic and oregano treatment. I just also finished my nystatin treatment last month. So I am taking treatment for gut issues and sleep issues. So ever since I've started the treatment, I've seen like almost 50% betterment in my sleep and everything. But one problem I'm facing is uh, when I sleep in the night, it also happens that I get up in the night, midnight around 5 or 4 a.m. for urinating. So this is happening constantly over the last, I think, at least 30, 40 days. And I've tried everything to make sure not to wake up in the night, like reducing my water intake, and also wearing warm clothes and closing all the windows because it's also cold in Bangalore. But none of the strategies is working. I'm not able to figure out why my bladder is getting full, like around 4 o'clock, 5 o'clock in the morning, and then I need to pass my urine and then sleep again. This is disrupting my sleep. So I just want to ask you, like, what else can I do to make sure I don't wake up in the night?
Right. So it's a tricky question. I'll attempt to answer this. Okay. Now, typically what we see, the urine holding capacity of the bladder can reduce temporarily. Now, when we are dealing with the fungal infections will produce a lot of oxalates. Even when we are trying to clean these infections, then also oxalates will get released. And typically they go in the urinary bladder and they can sort of irritate the bladder. So one possibility I'm thinking could be reduced capacity of the bladder. Not
Uh-huh.
that because of treatment you start making more urine. Unlikely, right? The kidney function will improve, but not necessarily make more urine. Okay, but maybe possibility is not holding on to that much. So a sodium bicarb, which is ENO, or something called optihistamine that we have, that can slowly, gradually help to mobilize these oxalates from the body. Then irritation of the urinary bladder will reduce. Then holding capacity can come to normal. Probably you don't have to get up at night, probably.
Okay. One other question is, so largely I try to fit to the diet whatever has been recommended for me, but sometimes it so happens that you have to go out and you have to eat outside. So for example, today at 2:30 p.m. I had jeera rice and dal, and even now until after 6 hours or 6.5 hours, that food is still not digested. I'm still getting burped. So it takes such a long time to digest when I eat outside, but at home it does not happen. When I'm following the diet, it does not happen. Any reason why that is happening?
So now, typically when we say it is not getting digested, we have a sense of fullness in the stomach.
Yeah.
When you eat white rice and we already have fungal load, we'll ferment and make more gases.
Uh-huh.
Probably digestion has happened, but the gases formation is a problem. That bloating and fullness will happen. So taking a digestive enzyme, maybe Unizyme is one of the tablets that you can get on any chemist store. Unizyme. Right after meal, if you go outside, take white rice, take some Unizyme, and they will sort of quickly break down the carbs, and less is available to the fungal infections, and possibly less bloating and less heaviness, and you will feel comfortable.
Okay. Thanks, doctor. One last question. So ever since I started treatment, I've lost around 8 to 9 kgs. I mean, though I'm not really worried, I know I'm on the treatment plan, but whoever sees me, they tell that, you know, you lost lot of weight, lot of weight. Would this weight be restored or should I worry about it?
There's no way to worry for anything anyways. Okay.
Okay.
Why to worry? Right. So goal is we want to improve the weight. Yes. As digestion will improve, you start making the food as a part of your body. And then after your stomach is, we can give more proteins and etc. to restore the weight.
Okay, sure. Thanks, doctor. Thanks a lot.
So yeah, sir, can we take one question from the chat?
Yes, please.
Yeah, okay. So patient want to ask, can we reintroduce gluten and dairy occasionally once we heal our gut?
Yes. So if we seal the leaky gut and the microbiome diversity has improved, then tolerance to gluten will also improve. But then I cannot say for surety that it is not a problem. But tolerance will certainly improve as we have a better diversity and leaky gut is resolved. But then one safety precaution can be taken. You can take a gluten digest enzyme along with the meal, 1 or 2 capsules, so that some level of protection is there. The enzyme will break down the gluten and it will be relatively less reactive to the body.
Okay. So next turn is Chitra. Yeah, Chitra.
Hey, hello, doctor. Thank you so much for answering so many questions for us. So my question is regarding CKD. So my father has this CKD stage 4, and I have tried low carb and high fat and
Right.
0.8 gram protein. Okay. So I was taking the animal protein as well, like hung curd and paneer only, and that was like in a limited. We used to calculate and measure everything. But we could see not much improvements on the same. So what kind of diet we can give to him, what could be done in that case, because low carb everything has been tried already.
So what do you say EGFR now?
It's 25.
So first of all, don't give any milk products, any wheat
Okay.
products, white rice,
Mhm.
complete any inflammatory thing off.
Okay. Okay.
Paneer is very, very bad for the
Okay.
situation.
Okay.
No
Mhm.
sugar.
Right.
Ideally, only 2 meals in a day. Restricted, no snacking, nothing. Only 2 meals a day, 11 and 6, 11 or 6, that around
Okay.
that time.
Mhm.
Okay. That's one. Now you want to make sure there's less toxins going in the blood, which means
Okay.
use digestive enzymes along with the food so that food is getting broken down. So less work
Mhm.
kidney has to do.
Okay.
Okay. Then
Okay.
it's a probiotic called Renadil.
Okay.
Renadil. Renadil.
Mhm.
Now this will also help reduce burden on the kidney. Now, when burden on the kidney is reduced, then there's a possibility to start recovering back.
Okay.
So
Okay.
morning and evening, Renadil 1 capsule as a probiotic. You can use extra probiotics, other probiotics also, but Renadil is must at least twice daily to be on. Then B
Okay.
vitamins, omega-3 is very, very
Yes.
important. Okay.
Yes.
Then certain nutrients for the mitochondria, for example, carnitine, CoQ10.
Right. So I'm giving
Right.
NAC, vitamin C, and some micronutrients that we are providing to him.
No,
What I
so
have noticed, like
and
on
it's
dairy, the EGFR came from 30 to 25, like when we tried low carb.
so again, that's that's a thing with the look, high fat or high protein does not mean it's actually good for the body. At this point
Hmm.
of time, we should not go high protein, right?
Okay.
Kidney has
Hmm.
to be relaxed. Even if we have to give any protein, that should be in the form of free form amino acids.
Okay.
right? Sodium bicarbonate will also help morning and evening kidney health. It will
Okay.
be useful. Acacia
Okay.
fiber,
Okay.
prebiotic acacia fiber. We have something called opti fiber, which has acacia, oligosaccharides, and few other fiber. That is now along that ozone therapy can help.
Okay.
Uh, along that glutathione can help. High quality phospholipids can help.
Okay.
Okay. Then how old is your father?
He's 64.
60. Then good. You know, then probably if basics we keep doing the basics for a good amount of time, then still a little bit of a stimulation of repair, which is stem cells or exosomes. That's a sort of, after we do all the baseline work.
Okay. So, sir, my follow-up question is like, right now we give him like mostly moong sprouts, and for the chapati, desiccated coconuts, almond flour, and the wheat flour
Don't give almond
mix.
flour. Okay, see, this is I think.
Okay.
See, first of all, low carb means almonds. Low carb means coconut. Sometimes too much fiber, which is difficult to digest, could be a problem. Almond certainly is a bad choice. Certainly a bad choice. Okay.
Okay.
I think if you really want, put him on a millet diet, safe and sound, 2 meals a day, little bit, whatever minimum he can handle. That's it. Plus amino acids, free form amino acids can be given. So if to support it, with too much of protein, and if he's not digesting, gut will produce a lot of toxic metabolites, and it will all poison the kidney.
Oh, okay, okay. So mainly the millet-based diet we can give vegetables and millets, right? There's no problem with the vegetables. So
Correct.
vegetables plus millets can be given. Moong sprouts are fine, or we should avoid that as well.
So again, I'm just giving my observations. I'm not a big expert on the area. But then I would say we need to test, find out what is the serum creatinine levels now.
Sir, creatinine level is 2.61.
So reduce protein. Too much protein is not a good idea. Free form
Okay.
amino acids to be given to ensure his body gets enough amino acids, not from a protein diet. Diet actually should be reduced. Bare minimum diet to be given.
Oh, okay, okay. All right. Kyuki, sir, the problem is like, he doesn't feel full if he
No,
doesn't eat
so
it like chapatis and all of that. Like,
see, again, my dear, he's only 65, right? He's
yeah,
20 years left to the life,
yeah,
right? At least. So we should attempt to at least stage 4 should become 2, 3, and 2 and 1, and
right, right.
that will take effort. Okay. If
Yeah.
I satisfy my tummy and I'm trying to protect my kidneys, it will not work. You want
Correct,
to
correct.
reduce the load on the kidney as much as possible. He should be doing
Okay,
1 day water fasting in a week.
okay. Oh. All right, sir. All right. Got it, doctor. Thank you so much, doctor. Thank you. Yeah.
No problem.
Thank you. Yeah, okay. So Vishnu Shetty is the next one.
Hello, doctor. My name is Vishnu. I have a few questions. My first question is, in 2019, I had acute pancreatitis. It was very bad, very severe. Right now, the current condition of the pancreas after MRI scan is that the tail part of pancreas is no longer visible. And one new development that was observed is there's a small patch where the pancreas is atrophic. It's between the head and body. So this is the situation, and right now my blood sugars are a little bit high, uh, and all the other factors relating to blood sugars like creatine, LDL to HDL ratio, and yeah, that's cholesterol, and all these things are perfectly normal. So regarding pancreatic beta cell regeneration, what can be done?
So Vishnu, first of all, we need to certain is it actually beta cell or is it insulin resistance which is causing? So you need to test your.
It is not insulin resistance because C peptide and there was one more test they did. Those results were fine.
Okay. Okay. Fair. Um, so regeneration, like I said, is a tough nut. I think I've spoken to you. You are in Germany.
Yeah.
We can try some energy medicine solutions, if at all that helps. I mean, of course, there's stem cells and all of that. We can give it a shot, but I cannot say anything for certain, sir. Unfortunately, there's a tough area.
Okay. Okay, doctor, and one more question. Since 2019, my vitamin B12 is always low. And vitamin D, because I live abroad, vitamin D is also quite low often. And yeah, iron absorption, anemia kind of a little bit is there. So is these also playing some role with
They
the blood sugar?
can, yes, they can affect the metabolic activity, certainly.
Okay. So should I supplement it regularly with for these things?
Yeah, you have to maintain the levels, good levels, yes.
Okay. Doctor, my next question is, my relative is a little aged. He just had kidney stones surgery. So is pea protein good for the person? Good for him?
No, stone is not a problem. Stone does not contraindicate that we cannot take in a protein. So certainly yes. Now make sure you choose a hydrolyzed pea protein. That'll be better.
Okay.
And since he has a stone already formed and removed, but then why do we have stone in the first place? And one of the reason is the oxalates, and oxalates are produced by the fungal infection. So you want to clean out the infections and ensure he's taking sodium bicarb or ENO empty stomach twice daily so that he don't form stones.
Okay. Doctor, I have one more question. My wife has Hashimoto's. Should cruciferous vegetables be avoided, or you
Not
suggest some remedies?
necessarily. So there's no such rule to the game. If they are causing leaky gut, yes. If not, there's no reason to discontinue that. But then Hashimoto is far more complex. There are infections, leaky gut, there are deficiencies, there are toxicities, there is circadian mismatch, all of that. So we cannot simply blame only the cruciferous vegetables.
And is there some diet that my relative has to follow because he just had the surgery for speedy recovery and things like this after the removal of kidney stones? I mean,
I think speedy recovery, water fasting will be better idea, right?
okay,
He can reduce carb intake. That'll also reduce the stone reformation.
okay. Okay, doctor, my last question, with what is a short, how good as a stem cell therapy has a chance with my pancreas?
So, my dear
Yeah,
friend, if I had the answer, I would have given you. Really, it's very, very uncertain. Okay, I don't want to sugarcoat and misquote anything. We have worked with few young children with type 1 diabetes, and there were some improvements, not significant improvements. So, until I see it with my eyes, I will not say it.
okay. Doctor, at your practice, do you also perform stem cell therapy?
We can help you with that, yes.
Okay. Okay. Thank you, doctor. These were my questions.
Thank
Thank
you.
you very much.
Yeah, okay. So Kamal is the next one.
Yes. Hi, doctor. Am I audible?
Yes.
Yes. My question regarding to probiotic. Before explaining my question was like my son is an autistic kid. I've gone through the NemCheck protocol. Have you ever heard of that? Yeah. So I've gone through that book actually. He explained about mainly inflammation and probiotics,
Mhm.
gut bacteria. So
Waste.
we have,
అవన్నీ వేస్ట్
yeah, basically,
అరే
we,
రేపు పొద్దుటికి కూరగాయలు తిద్దాం రా
someone,
Yes, go on. We're trying to unmute them, but it's
Mhm. Yeah.
okay.
yeah, yeah. Uh, uh, the actually doctor suggested that we have seen some improvements after having a prebiotic as well, like inulin. He suggested that initially.
Right.
After that, when the inulin doesn't work, like he suggested that rifaximin. So, have
So Kamal, now NemCheck
Yep.
was a good protocol, let's say 20 years back,
Okay.
when there was very, very less information around it. But today we can make a far more superior, personalized, more detailed plan.
Yeah.
Okay.
Yeah. My question yet to come. Actually, my question is like he said he won't suggest probiotic supplements. He says that like probiotic should be diversified. It should be a natural way. If we given a supplementation, it will be dominated one particular type of bacteria. He said that like I'm quite confusing. Like should I like I've seen some supplement which has 10 variant types of bacteria, 20 variants type of bacteria in the supplementation. Like should we really go for that one, or else what I was
So-
confused actually.
Right. There are two ways to look at it. One, if infections are there, I don't want you to do wild fermented foods or probiotics. Don't do it.
Okay.
Okay. A lot of them
Okay.
will recommend don't do it. Initially, you will see the results, then regression will come back. Problematic. Now,
Okay.
whether you want to do broad spectrum or narrow down. Now, if I want to target a specific infection, for example, one of the infections we typically deal is a fungal yeast infection, then
Okay.
one of my go-to strategy is Saccharomyces boulardii.
Okay.
If I'm dealing with Clostridia infection, which is a bacterial infection, which is also predominant, very, very high, heavy in these children, then my go-to strategy is Rhamnosus GG, Lactobacilli Rhamnosus GG.
Okay.
Okay. So if you have to improve, there's less connections with the family and socialization is a poor, then probably I'm thinking is a poor oxytocin. Then Rituri is the right go-to strategy. Okay. If I have to improve muscles and all of that, then Rituri is another guy. So likewise, sometimes depending on the infection, depending on the test, and we can choose which one to be given. But yes, if broadly,
Okay.
then if you don't want to get into specifics, you can use a broad spectrum with Bifido, Lactobacilli, and Saccharomyces boulardii. This combination, you can at least bare minimum you can start with.
Yeah, actually, I've seen multiple ways to get it natural, like sauerkraut, kefir, fermented.
Don't do that. Don't do that.
Okay. Okay. Okay.
We have
Okay.
done and made mistakes in our practice and realized until immune system gets into place, don't use wild fermented probiotics. No kefir, no kombucha, no sauerkraut, no nothing. Till immune system is back in place. If immune system is not back in place, immune system is compromised, especially it is compromised in these children, then these probiotics can be damaging. I will go to that extent.
Okay. So what is the other alternative, like probiotics naturally, like if we avoid
That's
this?
what Kamal I'm saying. You are keep so prebiotics, broad
Okay.
spectrum prebiotics, let's say. Good
Okay.
quality. This not only the inulin, there are so many other prebiotic fibers are available.
Okay. Fine. Thank you. Thank you, doctor.
Thank you. Yeah. Sunil is the next.
Hello.
Anji, Sunil.
Good evening, sir.
Good
Yes,
evening,
sir. Hello.
go on.
Good evening, sir.
Yeah.
Yeah. So my just a single question, sir. I actually have two questions. So actually, no, I'm struggling with this constipation, low in energy, and weakness over the day. Even before eating, after eating, the same things continues. So, and my HbA1c also is 6.2. So I consider myself as a pre-diabetic. So it is only a metabolic health issue or something I need to fix it.
So both. If constipation is also there, metabolic issue is there because of
Yeah.
that energy is poor, because the sugar is high. Plus, very likely infections in the intestines,
Okay.
which
Okay.
is contributing to the metabolic disease.
Okay. So then what is the strategy to fix the infection?
Okay, now strategy of controlling infections or building immune system or building metabolism
Okay.
is the same strategy. Lot of sunlight, hydration, darkness after sunset, good
Okay.
quality food, millet-based diet, no white rice, no gluten, no dairy, no sugars.
Okay.
Test for infections. If they're found, what kind of infections, then accordingly take actions. If fungal, yeast, parasites, bacterial, viral, take action accordingly. Accordingly, probiotics. If many toxins are there, any metals are there, start eliminating, nourish
Resistance
your
and
body.
elevated cholesterol.
That also could be because of the gut problems. No, it is total cholesterol can be elevated. Either your HDL is high, which is good then. If your HDL is high and your total cholesterol is high, it's a good thing. If your triglycerides are high and your total cholesterol high, it's a bad thing. Triglycerides can go high if you have problems in the gut.
Okay. Thank you. Thank you, sir.
You don't have to reduce your fat intake. You have to clean the problems.
Right, sir. Right, sir. Right. Thank you. Thank you.
So, sir, can we take one question from chat? Neha.
Yes, no.
Hello, sir. Is there a reversible treatment for a premature ovarian insufficiency? How to reach? Yeah.
Premature. I need to have more details about it before I can comment on it. Probably more testing, more reports before we can say.
Okay. So Neha, you will get a personal call for this question. Our team will connect with you.
Yeah.
Okay. Thank you, sir. Yeah. So Vinita is the next one.
Yeah. Good evening, doctor. Yeah. Can you hear me?
Yes, ma'am.
Yeah. I had a question that I get clients who have high fasting insulin, 22, 23, but their HbA1c is absolutely normal. So
Right.
how does that happen?
We can call it pre-diabetes.
Yeah, but it's not even in the pre-diabetic range. It's absolutely 5.5, 5.6.
Now, okay. No, let's understand. Now, it's important for everybody to understand. If your sugar dysregulation have started going up, that means you have become diabetic already. Blood sugar or HbA1c more than 5.6 means diabetes. There's no pre-post then. It is already diabetes. Pre means, technically, pre means not by the conventional definition, by reality of the definition. Pre means sugars are not going haywire. Your conditions for diabetes are building up now. Okay. Now, why do you have high insulin? Because your mitochondria is compromised. The mitochondrial health is compromised. So if we improve your metabolic function, if we improve your mitochondrial health, then your insulin will come down.
Okay, but and this one I'm talking about, he is a 14-year-old child.
And that's fine. That can happen if child is not getting sunlight, child is not hydrated, child is eating a lot of junk and a lot of carbohydrates, and his body is malnourished. He has stomach gas issues and all of that. Then it can happen, and we can fix it.
Okay. And I also want to, another question is, my daughter has Hashimoto's hypothyroid. So, can she take soya-based protein supplement?
Non-hybrid soya, no problem.
But how do we know that?
You have to choose a brand, madam, a good quality brand. For example, I think Nutrilite is a decent brand if she has to go soya-based protein.
Nutrilite also has, okay, it has soya and some other combination, I think.
Then I think most of the brands, if they don't specify it is hybrid. If it is hybrid, don't do it.
Oh, it should not.
But why do you want to do soya then? You can choose a better quality protein. There's so many others.
No, in the sense that in her food intolerance test, like casein was a problem. So probably whey protein will not suit, isn't it? If casein was a problem and cow milk was a problem.
Okay. So casein is a different protein. Whey is a different protein. That's
Right.
one. Now, more importantly, why does she have sensitivities or allergy reaction to different foods? Because she has a leaky gut, and leaky gut is contributing to the Hashimoto's, right? And why does she have a leaky gut? Because she has infections in the gut or lack of raw material which will seal the leaky gut. So the question is not which protein, first of all. First, let's solve the problem.
Okay. So solve the problem how?
If infection is causing leaky gut causing food allergies and sensitivity to casein or Hashimoto's, we want to solve the leaky gut.
But what are the symptoms of leaky gut? Because she doesn't seem to have any apparent symptoms.
If she has sensitivity to certain foods, if she has a autoimmune problem, there is some leaky gut for sure, whether symptoms are not. So sometimes not necessarily every time the person will have symptoms, not sure, not always the case.
Okay, because the IG levels were 250.
Fair. That's quite this thing. But bottom line, see again, if she has an autoimmune problem, what is contributing to the autoimmune problem?
Okay.
We don't have to always get into whether this marker is positive, then only I will consider. I have told you two things, right? Autoimmunity plus food sensitivities. That means leaky gut is there.
Okay. But one important thing which you mentioned is even if she has casein problem, she can take whey protein anyway.
Possibly, yes.
Yeah. So whey protein is okay. That should be fine.
But choose whey isolate high quality from a good brand, because a lot of time they will have mix-ups. So whey isolate from a good brand will be choice.
Okay. 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 Thank you, doctor.
Yeah, okay, thank you. So next is the Amrit part.
Hello, doctor.
Answer.
I have a mild asthma problem, and in last winter, I have a Aspergillus fungus infection in my lungs.
Right.
And for that, I have taken a 3-month course with Vericonsol, and that is done now. And now I left with some scars on my lungs, and for that, I can doctor says you can't remove the scars from the lungs, and you have to take care more now. For you should not be again infected with the same fungus. So my question is, can we treat this mild asthma from FM this functional medicine thing? And can we remove this? Can we treat this mild asthma, or it's for lifelong problem?
Right. It's not a lifelong if we solve it right now. One of the reason is high histamine. High histamine can be produced by fungal infections, can also be if leaky gut and some food triggers, especially milk triggers could be there. So if we again remove the irritants, make sure gut is good, build the immune system, then infection will get taken care, histamines can be taken care, and asthma can be taken care. Now, can we remove scars? Not very sure, but yes, enzymes, there are certain enzymes like ceratopeptidase and nattokinase that has the ability to minimize the scars. Let's say then if not 100% gone, but minimize them. We can certainly minimize to some good extent by using high dose proteolytic enzymes on empty stomach.
So you are suggesting I should take supplements for this asthma thing, or should I take proper any kind of treatment plan from you guys? Or
Again, we should evaluate, Amrit, right? What is the
Okay.
infection? What is the toxin? What is the symptoms? It's only not asthma you might be having, maybe other issues also there, right? So overall evaluation, and that'll give us a better picture.
All right. So you're saying we have to diagnose it by testing the things, what's going wrong in the body.
Correct, correct.
Okay, got it. And the next question is regarding this. My kid has autism and is already enrolled to your batch. And yesterday we received this NutriFit report in which they say this clostridial infection in the gut. And my question is that in our family, our grandparents has the serious gut problems from last 4 or 5 years, and they are managing somehow with the medicine, and it's going on and off. Do these gut problems travel in the family, or is it related to this thing, or not really?
They don't travel per se in the family, but yes, a microbiome comes from the mother. Mother has a poor microbiome, the child can have poor microbiome. Most lot of antibiotics, lot of vaccines, big problem which is affecting the microbiome.
Okay. So means if grandfather parents have the gut issues, it's not any problem for us or our.
No, not related.
Okay. And for them, I need to know, can we treat their problem with because they are 70 plus years. So can we treat their gut problem?
But the only thing is, as you're aware already, at that age, typically people are not willing to change.
Yes, definitely, yes.
If they are not willing to change, then I think there's no point of,
Okay, I understand. Yeah, I completely understand.
If they're willing
Okay.
to change, we can help. We have
All
elderly
right.
people, but
Yeah,
they
I
should
understand.
be willing to
Yeah.
change.
Yes, yes. And just one last doubt. In this Nutri test, we also have the biomarkers for the H. pylori infection.
No, the NutriFit doesn't have H. pylori. But then again, my take on that is, why do we have to specifically kill one microbe, right? We just have to bring a balance. Now, H. pylori is not that it's an abnormal thing. When it goes out of balance, then it becomes an abnormal thing. And our job is to find the balance.
Means we don't need to test it if it's there or not.
Okay. So I have worked with so many gut problems, and many of them had come to me with H. pylori. Many of them we did not even bother to test, but they all gotten better.
So with the treatment plan, it will taken care of if it is also there.
Correct.
You are saying.
Correct.
Oh,
Correct.
okay. Thank you, Dr. That's it.
Okay, so Madhu Sharma is the next.
Yes, good evening, Dr. Ashwani.
Namaste, ma'am.
Namaste. So I have some questions. Just now, before those questions, I just want to go back to one of the questions you were answering when you said thyroid T4, TSH is normal, but T4, if T4 is normal, then also you can't call it hypothyroid. That is what you in response to somebody's question you answered.
So I said if T4 is normal,
yes,
it is not hypothyroid.
Okay, but then if T3 is low, then
still it is not hype. See, again, my understanding. How do we define whether the gland? See, when we say somebody is hypothyroid, we want to say that gland is not producing enough.
Yes.
Now, what is being produced by the gland? It is largely 80% of the hormone produced by the gland is T4.
Yes.
Now, if only T4 is low, I will consider the gland is poor.
Mm-hmm.
If T4 is produced, which is normal, but it is not converting into T3, then it is not a gland problem. It's a systemic problem. Then we want to reduce infections and nourishment and metabolic corrections and all of that. Then that's a different story.
And then in case for T4, T3, there's not much of a out of whack, but free T3, 4, T4, 3, T4, they are that is low. In that case, so we must every time consider that also free T3, T4 along with this?
So again, my take on this, ma'am, is now T4 is produced.
Yes.
Now, body will decide whether it has to be free or bound form,
Yes.
right? So again, it is not because of the gland; it is the systemic variations.
Mhm.
Now, what is need to be produced is produced by the gland. Now, body has to decide whether it has to go act or it will keep it bounded, because body don't want it to work so much.
Mm.
But and when, let's say, I'm stressed out, for example, my metabolic activity is slow in that time, then body will not increase free T4.
Okay.
So in that case, it's not a thyroid problem. It's rather a problem of the, stress is what is affecting me. So rather I look at the thyroid as a problem. I look at other issues.
Okay. 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 So my question actually was regarding the supplements that I've also been taking since some time now, the leaky gut care and others. For how long do we can we take them? Like, how do we know that?
There are two ways to it. One, you do it for 3 months. If you feel good, you stop it.
Okay.
Or if problem is not taken care, body needs more, then we test. We see what more is required.
Mhm. And so these supplements can be combined also, like leaky gut care, and if any supplement, magnesium, the powder thing, if they have to be taken together, because
most of the things can be. There is
can be
no, yes,
taken.
most of the things can be put together and taken.
Okay, so because I was more concerned about my constipation problem, because with so much of good fiber diet and everything and all, and I'm also almost of gluten. Just once a day I have gluten, but otherwise this constipation problem is not being solved. So I'm taking leaky gut care for this. So is it okay? I mean,
If it is helping, yes, yeah. It's
it
very
has
simple
not.
thing.
No, I've not found any. I just started taking it since a week. So how long should I wait to see if it is helping?
So if it is a chronic constipation, but probably leaky gut might not, see, for a mild constipation, leaky gut can
No,
do a
this is
job.
the chronic. It's a chronic constipation since some years now.
So I think magnesium will be better choice, ma'am. You can add magnesium, that optimal magnesium, to leaky
Even
gut.
or ionic powder form, any powder.
Both, yes, anything, yes.
The citrate form also will be okay.
Correct. Citrate is good. Oxide is good. So both or anything, both are okay.
Okay. Right, that is main thing I would. And then what about the probiotics and all that pre-probiotics? How do we decide when along with this leaky gut, when we're giving these leaky gut care and things like that, can we give probiotic biofilm care or this thing, any of those Candida care or something like that? Candida care, of course, is not a probiotic, but biofilm is, I think.
No,
So
both are probiotic, ma'am. And the week actually, what I do is I alternate them.
okay.
One day Candida care, one day biofilm.
I
So
see.
both will have a different diversity to the.
So Candida care is basically for fungal, right? For SIBO.
Correct. It's a probiotic, but yes, specifically designed for fungal.
How do can we give? I mean, do we need to give leaky gut care? This thing, Candida care, biofilm. How do we decide how to divide these?
So I think we can discuss if you have more questions separately. But in the brochures, no, there is some protocols are given.
Yeah.
Maybe we can use them as a reference.
Yeah, I saw the brochure. Most of the indications are being overlapped for many these things. So that comes a little confusing. Which one? It's the same thing. Most of these supplements with the brochures, the products that I mentioned, they have overlapping indications.
Yeah.
So,
right. So see again, like I said, most chronic problems, similar problems are behind it.
Okay.
So there's an overlap in the, see again, for different problems, we don't have to do different things, same things, but different outcomes we can have.
Okay. And one last question is, what if the B12 level is very high? Supposing it's this mild anemia, but B12 is coming very high. So
is it without supplementation or with
without
supplementation?
Yes.
Very unlikely that without supplementation B12 is high, but then we can look.
That time she had supplementation about some months back, and when she got it done, about 2-3 months later, it was still high. So it could be because of that.
Yes. So one thing is she has taken a supplement, but the supplement form is not good enough, which is not getting consumed. That's
Okay.
one problem. So sometimes it's only B12 is taken, but B9 is not taken. Then also B12 can be unconsumed.
Okay. Okay. Thank you, doctor.
Okay, thank you. So we will take last 3 questions, and we're also running sort of time. So yeah, Jivita.
Hello, good evening, doctor.
Good evening, sir.
So actually, sir, we didn't know much about these functional medicines. We are new to this. So like just want to know like how functional medicine helps to treat rheumatoid arthritis, sir.
Okay. So rheumatoid arthritis is one of the autoimmune problem, and it's not a problem of the joints. It's a problem of the immune system attacking the joints. Okay. So if we have to solve rheumatoid, we have to stabilize the immune system. Now, if we have to stabilize the immune system, we have to remove what is disrupting the immune system.
Okay.
Right? So one of the very, very common thing that we see in rheumatoid, gluten and milk products and sugars can disrupt the immune system. Another problem, if the person is having poor digestive health, this means the microbial balance in the gut is bad. This can trigger immune problem. So if that is the case, we need to clean that out. Another very common thing we see with autoimmunity of rheumatoid is heavy metals, mercury, aluminium, lead, etc., etc. If we can test and find out, and then we can eliminate that and nourish the body. As we do that, immune system will calm down, damage on the joints will come down, inflammation will come down. If it is not a late stage manifestation where damage is not done, there's no damage happens, more of inflammation, then it will recover completely. Otherwise, further damage can be stopped for sure, and body has the ability to restore some of the functions.
Okay, sir. Okay. So how long that medicines, functional medicines we need to take, so like for RA?
So typically we start with a 3-month program. In 3 months, a person should start seeing a change.
Okay.
In most likely, but stabilizing immune system can take 6, 9, 1 year, depends on how big is the problem, right? How long the problem is there.
Okay.
And how much is the problem, right? Intensity of the problem could be different for everybody.
Understood.
So that will decide what is required.
Yes, understood. So like any suggestions for lifestyle, so like for to come out of that?
Lot of sunlight, no gluten, no dairy, no milk products, no sugars, no white rice. Millet diet, jawari, 2 meals a day, lot of sunlight, lot of good sleep after sunset. Don't expose to lot of white lights. Hydration, basic. This much do. Probably 20% of the problem is taken care.
Okay, sir. Okay. Thank you, sir. Thank you for this good information. Thank you so much, sir.
Okay, thank you. So yeah, Priyanka. Priyanka, are you there? So, sir, can we take next one? Sure.
Hello.
Yeah.
Yeah. Hi, Meera. Hello. Good evening, sir.
Yeah.
Good evening.
Actually, this is regarding my daughter. She will be 3 years by this August, and she is like supposed to be at risk of ASD. So on the spectrum, so there was a few protocols that we are already following, that GF, CF, and SF diets, along with the millets diets. There is no sugars, or either if there is sugar, sometimes it is form of jaggery, and there is like 90% there is no wheat. Sometimes she'll crave for a biscuit or so she'll take a half of a biscuit or kind of thing. So the diet kind of thing, and there is no fermented food also. Like I'm not giving any kind of fermented food. More of citrusy foods are also, like I'm not giving much of citrus fruits. Plus, she is on the like treatment of Ayurvedic thing also, along with the Panchkarma and all. So and on homeopathy also. So by doing all this for almost 6 to 8 months, what changes I have seen was like her reciprocative language development has multifold came. has came multifold. Like she can sing the rhyme, she can see the flashcard and at least tell about 100 to 200 words. And there was a regression when all this happens. This happens after mostly MMR vaccination around 18 to 20 months of age. So she was regressed, and there was like 8 words she used to speak at that time. And from this, we have came this far. Her eye contact is established. Her hyperactivity has reduced somewhat. Sometimes again it comes up in between periods. Will be like this. Then her motions they were not pretty bad at that time also, but now more of regularized.
That's good.
And she can follow one-step instruction.
Right.
Only thing is that right now also I am expressive language development is not much there. She's not into any kind of conversation. There is no social behavior like social play or something is not, it's not there. Plus little bit of salivary like dribbling of saliva is there sometimes. So her oral muscles are little weak or poor, and she has somewhat a chewing problems. Like she can chew hard objects, but if I put a or something, she won't be taking that. She won't even chew that. I think that chewing instinct has gone of this soft food.
Not the instinct doesn't go away. It is actually ability to chew. It's a mitochondrial problem.
But she can chew carrots, she can chew cucumber, she can chew on biscuits, she can chew on some kind of jawar puffs and kind of things also. But she won't be chewing that soft food only.
No, that is a sensitivity issue then.
Okay. And she puts everything in her mouth, whatever she gets, a plastic bottle or a paper
Parasitic
or something.
These are parasitic infections.
Parasitic infections, basically.
Yes.
Okay. And for this, you were telling of some kind of poor oxytocin response also. Because there is no social play.
Social, yes. Yes.
With family also, she won't interact much.
Correct.
So what kind of like outlook we can have? And plus, suppose if we start with supplementation thing also, how we'll tackle this die-off reactions with these 2 kinds of treatment which are already going on. And plus, I am giving her structured water in this, I am giving her gold charged water, not sun charged water.
Fair. That's good. I have no experience with gold charge water, but if it is helping. So now, Priyanka, if what you're doing is working, see, anyways, it takes time, right? Now, if your doctor knows what they're doing, for example, you know the symptoms and they know the reason and they explain you and they're working on all of these, do we need to get into another treatment? Maybe not. As long as your treatment is working and slowly, gradually, you are seeing a change. We need not necessarily change the treatment pattern, right?
Okay.
But if you feel that now probably it's not moving ahead, you have you hit
Yeah, for like 2-3 months, I'm experiencing a stuck up kind of thing.
Correct. So if you're feeling that, then probably we can come into play. Right.
And like some kind of supplements which don't give much of reactions and which can be helpful to her.
See, either we go full on or we don't go, right? Let's say parasitic infection, she is chewing things and parasitic infections are there. Now, how do I kill them?
So, yeah, we have done the deworming through Ayurveda also. We have done the deworming through
It takes
homeopathy
time.
also.
It can take months to years to clean parasitic infections. It doesn't go in 1 round, 2 round, 3 round. These are tough infections, Priyanka. Okay. The bottom line is, if the doctor knows it, they're repeatedly doing what needs to be done, it's fantastic, as long as it is working. Now, you say, I only want the positive outcomes, but I don't want a reaction. But if I do kill the parasite, reactions can happen. Because parasite will be holding on to a lot of toxins, and one of the toxin is heavy metals in the parasite. When I kill the parasite, toxins will spill over. Right? If body can detox, no reaction will happen. But if body is not able to detox, then reactions might happen. So that's the nature of the treatment, right? So
okay. And so I was just fearing for again a regression thing.
Again, you have to understand, these are not permanent regressions. These are temporary regressions, and After that, child comes out more strong.
Okay, it's for sure.
No. See, I'm
It's
saying
for sure. And one more thing is that I want you to give me some insights for this detoxification, which is on high fashion right now in this ASD market, like fumic acid, humic acid, and clinoptil detoxifications.
these are good.
So, do you also use them in your practice? You see some kind of side effects with this kind of things? Are they
These are
safe?
fairly safe. See, Shilajit is largely fumic and
Yeah, Shilajit is the ingredient, basically. Yeah.
Shilajit is a very potent stuff. These are adaptogens, very powerful, no side effects if a good quality. Zeolite is also very good if good quality. So you don't expect, but yes, you need to do it with a guy who knows the game. Sometimes that can make a difference, right?
Okay.
I don't
Okay.
use much, by the way. I don't use much. I
Okay.
use
So, like till what time I can like suppose if we are taking the supplementation thing also along with this homeopathic treatments and with Ayurvedic treatments. So, what kind of changes we can see of? First of thing is that, and another thing is that take long, and if we like stopped it abruptly or slowly, what will the symptoms will again show up? Will the regression will again happen? So will the basically the question is that the root
You
cause
have
will
to
be solved
understand
or not?
different behaviors are stemming from different problems. Not everything is in the brain.
Correct. It's in the gut
Chewing is a
mostly.
parasitic. Okay, let's understand. Chewing is a parasitic infection.
Okay.
Socialization potentially due to low oxytocin. Okay. If communication is a problem, brain has to become healthy. Sensory issues, nerves has to become healthy. Taste buds has to become healthy, right? Different problems, they're stemming from different problems. Now,
Okay.
if brain has repaired, toxins are out, infections are out, then regression will not happen. But let's say you clean 30% of the fungal infections, 60% of the parasitic infections are cleaned. Chewing is gone, itching is gone, for example. You start feeding sugars. The infection will grow, itching can come back, right? Because infection has to be controlled completely to a greater extent. So that even if we do give sugar, it should not come back quickly. So that depends on how much work is done, right?
No, what amount of like what kind of years you are demanding of? I just wanted to understand so that we can plan on the life, doctor. The life is very uncertain right now.
1 year to 1.5 years for your child is a good time span. I would ask for to make her almost normal.
Okay. 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 And sometimes she do toe walking also. Sometimes should she do
Fungal
hill
infection.
walking?
Fungal infection.
But they are telling that it is associated with mercury also.
Mercury can downregulate the immune system. Fungal infections can grow, but it is more of an oxalate problem.
Okay, so for some kind of antifungals should be prescribed for that.
I'm saying if mercury is there, you test. If fungal is there, you
Sorry?
test. We can test all of these things. You don't have to randomly do things, right? We can test and find out what is there, and accordingly we take action. We don't have to take empty shots.
Okay, so along with these treatments, this thing is possible. You are telling me that we can go like because this will be 3 systems. The system will be very complex then.
It can happen, but we have to look at it, right? We don't have to overwhelm also.
Yeah, because of that, I was fearing to do any commitments. That like the system will be very complex and nobody will going to know that which medicines is curing and which medicines are creating the reactions.
You're right.
So on that note, like till what time I
That's
can
what
wait?
I'm
can just give me
not
the
against Ayurveda. I'm not against homeopathy, my dear. I'm saying if it is helping, continue with it. If you see it is no more helping, let us intervene. And we will take care from there. Okay. You allow us to deal.
Okay, then for the time being, we have to stop
Now, Priyanka, you have
this
to
and then
understand.
allow you.
No, whether you want to continue, still you have to allow us, right? If I see a problem with that, I will take a call. But if you go to your doctor, no, you don't do this, do this. See, somebody has to take a lead on that. Even you're doing homeo, even you doing what I'm doing, even you doing Ayurveda. One guy has to take a lead on that. If I see that is a problem, I tell you don't do it. If I don't see a problem, it's fine. Somebody has to take a lead. That's all.
Okay.
So yeah, Priyanka, if you want to really start with us, you should take a 1 month program, as I told you, and final decision is yours. Yeah. So thank you so
Okay,
much.
Meera, we'll connect with this. Thank you, doctor.
Sure,
Thanks a lot.
Sure, Priyanka. Okay.
Yeah.
Okay. So, sir, can we
Okay,
take this last question, Surabhi?
Yeah. Yes, please.
Hello, doctor.
Yes,
Thank
ma'am.
you for taking my question.
No.
I have hidradenitis suppurativa for almost 12 years now, and I recently gave birth 3 years ago, and after that I developed spondyloarthritis in my back.
Okay.
And after that, I have done a 6 months AIP diet in which I had no grains, no sugar, no only quinoa, right? I lost 9 kilos, but my symptoms didn't really go away at all. And because of living on a restrictive diet for so long, I then ended up now cheating a lot, and now I'm back to having quinoa as well as having sweets, so it's not a great place. But I want to understand one thing, that how do I sustain this diet? Like, I know all millets also have gluten in it in some form, so I'm just fearing everything now, and I don't know how to live because I can't be on AIP forever.
So fine. What you have is more of a problem driven by fungal infections. So fungal infection is the biggest your worry. HS is majorly a fungal problem. Now, little Kodo, Barnyard, Foxtail, Brown Tail, don't worry about gluten. Go ahead, do it. Absolutely, no problem. Jawari, no problem. Okay, there are plenty of options. You can choose gluten-free attas, make parathas and all of that, no problem. But fungal infection has to be taken care. And if it is there for 12 years, it is going to take time. Hardcore work has to be done to clean out these infections. And this is one of the reasons contributing to your spondylitis also. Right. So, and make sure you're getting a lot of sunlight. Sunlight is antifungal. You are not spending a lot of time under Wi-Fi's and all of that, and mobile networks and all of that. You have to protect yourself because radiation from the electronic devices can grow more yeast in you and HS and more immune dysregulation. Plus, we can test you thoroughly if heavy metals are a big problem, if heavy metals are there. So we can build the immune system for you and help you come out of it, but it takes time. That is you already committed. You have done it for 6 months, but it still needs time, right? Plus hardcore work on it. Maybe drugs also, antifungal drugs also, and parasitic drugs also, right? So a lot of nutrition, but yes, it can be taken care.
Okay, I've actually since 12 years taken so many medications that I now am only on Nucoxia once a day, which helps me reduce the pain for the spondyloarthritis. Nothing for the HS because I've tried all antibiotics. I've even been on steroids for some time, and I've even tried SARS and everything. Nothing's worked. So now
I did not say antibiotics. I said antifungals, antiparasitics. Antibiotics will grow the problem.
Okay.
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 It's ulta. And a lot of nutrition. And don't take any carb and sugars and fruits.
Okay. All right. Is there any place where I can get literature on this from you guys?
Yes.
These are very, very abstract problems. Okay. Literature. See what I'm saying, as per the conventional system, there's no answer to it, right? So if there's no answer to it, where is the literature coming from? See, literature is produced by the money. We guys don't have money. We are sitting at night and talking. People who have money, they don't have time at night, no.
But we
So
want to listen to you,
these are
doctor.
abstract. So I'm saying hardcore data will not be there, but bits and pieces. For example, is there a connection of HS with fungal? You might find a lot of literature. Is there a connection of heavy metals to fungal? You will find a lot of literature. Is there a connection of sugars and fungal? You will find a lot of literature. Is there a connection of autoimmunity with fungal? You will find a lot of literature. Bits and pieces. So somebody has to put these things together.
Okay. And I'm also on a lot of supplementation. I'm taking magnesium and vitamin D and iron and this for a very long time. And every time I stop, I start getting
Don't take
deficit.
iron. Don't take too
Okay.
much iron. That's calcium and iron are two supplements we have to be careful about. And ideally, for any supplement, you test, find out what is missing. And along with, like I said, nutrition building, immune system building is important with nutrition, with supplementation, but then more importantly, infection control is predominant. So, see, let's understand this also way. What you're feeding yourself, even a supplement you're feeding yourself, can also feed the infection. So, so it really has to be careful, especially iron and calcium. Big problem.
Okay. Great. So I basically need to figure out if I have fungal infections and then treat that first
You
before
will
doing
certainly have.
anything.
If HS is there, it is there.
And fungal infection in the gut or in the
See, again,
locations.
so what is in the gut is everywhere,
Yeah,
right? How
sure.
can a tiny microorganism just staying there only, right? So it has come to the level where it is making an abscess and it's leaking out, oozing out.
Yeah. Yeah, no, it's because I've taken a lot of like dermatologists have given me a lot of antifungal creams and all of that, which now I believe that it's the gut that needs to be fixed and not
Yeah, right. So
the
you cannot fix
cosmetic
it
things.
locally. You have
Yeah,
to fix
exactly.
internally, gut and blood and everywhere.
Okay, sure. Thank you so much.
Yeah. Okay.
Okay, thank you. Thank you. Yeah. So Sri Devi, the 15th number, her husband is alive now. So want to ask one question, last one question. Sri Devi, are you there?
Yes, thank you so much for accommodating me. Can you hear me?
Yes, go on, sir.
Yeah, so I'm male, age 40. Biggest complaints are lack of energy, feeling sleepy, lack of motivation. Did a bunch of tests. We do a yearly health check, and I think the parameters that are out of bounds are usually cholesterol. So LDL is usually high, like around 4. HDL is okay, is above 1, just above 1. Triglycerides are all good. HbA1c is fluctuating between 5.4 to 5.7, 5.3 to 5.7 for the last 4 years. And EGFR is fluctuating between, let's say, 80 to 90. I recently got a 4 mm kidney stone on my left kidney. I'm using medication for it. Not sure if it's dissolved or not. But those are the only things that are out of bound. And recently I also got a test done for fasting insulin. It's 10.3. And ANA is negative. Vitamin B12 is good right now. Earlier it is not good. CCP test also was okay. RA factor, C reactive protein, all these came out negative. And this is impacting my mental health also. So when I consulted the local doctor here, he usually suspected the B12 and it's good. Then he moved on to, HB1AC, which he said is fine. And then he looked at all this autoimmunity stuff, fasting insulin and everything. and then now he's bordering into the mental health area around depression and all. But I do feel this physical weakness. It's not recent. It's like chronic. For as long as I remember,
Right.
I feel this way.
Right.
So yeah, just
Right.
trying
So,
to see how.
weakness literally means low energy. Depression is low energy. It's a metabolic disorder. We just have to make your mitochondria better and remove what is affecting the mitochondria negatively. And I'm sure you will come out of it.
Okay.
We can work
So
on that. You can connect with
okay, so HbA1c between 5.3 to 5.7, like is that it's fluctuating,
so
but it's
that's
in between
again,
those.
that's a diabetic marker,
Hmm.
right? So before even diabetes appears, metabolic disorder can happen,
Okay.
right?
So you're saying that it could be primarily mitochondrial.
It is micro. If depression is coming up and you feel fatigue, energy is less energy means mitochondria, right? Energy is less.
Okay.
Very simple.
So even if it is like chronic, like it's been happening for, let's say, for as long as I remember, right? So
How old are
it's
you?
I'm 13. I'm 39 right now.
You're a young man, my friend. Doesn't matter. See, I'm 40. I expect 85 is my number. Then I should be on high energy for rest of my life, no? Even though my past was bad.
Yes.
Right. So we should be taking care of it.
Okay, the reason I was asking is because if it is something that's like genetic or by birth, because as I'm saying, right, this is not something that has happened for the last 1 year or 2 years. It's just been there and it's just getting worse.
Doesn't matter. Doesn't matter. If it is getting
Okay.
better, is progressing means there's a scope to fix it.
Okay. So
Patience.
what are the next steps for me? Like, how do I contact you guys?
Dr. Meera.
Yes, I'm connected with you. So yeah, I will do a call. Dhruti, I will do a call tomorrow as well, and with you also. Yeah.
Okay.
Okay. So, sir, there is one last question, Reshma.
Yeah. Yes, Reshma, go on, please.
Reshma, are you there?
Yes, good evening, sir. Good evening,
Good evening.
doctor.
Yes.
Doctor, I was just wondering, I have a question. The heart efficiency of the left ventricle is very low.
Okay.
It is 25 ejection fraction, 25% only.
Okay.
So, is there any functional medical treatment to increase the efficiency of the heart?
Right, right. Who's the patient? What's the age?
Myself only. I am 45.
Oh, okay, okay.
Yeah.
So certainly. So Rishna, what do we mean by ejection fraction? Basically, the heart is pumping. We're not able to exert enough pressure by the heart muscle, so it's not able to pump out enough blood. Correct? The mitochondria, which has to make energy and thereby create contractions, had gone back.
Okay.
Now we have to improve the mitochondria.
Okay.
Right? As we improve the mitochondria, energy production will improve and contractibility improve and ejection fraction will improve.
Acha. Because I have been given Lasix, Digoxin, Cardivas. So it is very painful. Lasix is so tiresome. Means we have to
Because
go to
it is
toilet.
draining. See, LASIK is only draining you. Its contractibility has to be improved. It's like let's say I have a car tank with an engine. Now my fuel is the problem. Either I burn the fuel by improving the mitochondria or I puncture it. Now LASIK is only puncturing the kidneys, right?
Right.
So we have to improve the mitochondria.
So my two questions are, if the functional medicine will help me, maybe in say like 1 year time, I may improve. then will those allopathic medicine be stopped forever?
Now, allopathic medicines are emergency medicines.
Okay.
If you have water congestion, you take diuretic, that is a LASIK. Now, if your mitochondria is getting better, it is able to pump out the blood, there is no swelling. Why do you need a LASIK? You don't need it. So as we improve your health, we can reduce the drug because there's no need of the drug.
Okay. So, what, according to you, what will be the timeline of the course as per my age?
So you are very young, Rishma. We will start with the 3-month program and you should see a difference. At least from 25, it should become 30.
Acha.
So, 65 is the upper limit, right? So healthy is 65. Let's say in 3 months, we are able to make it from 30 to 35. Then we continue. If we say nothing happens, probably we will not fail, but I'm just sort of
Okay.
Okay. So at
So
least
will
we
there
can
be
keep that as a benchmark.
will there be lot of tests involved in this, or only the gut part?
Enough test has to be done.
Enough
Metabolically,
test.
nutrition, toxins, and nutrition, and liver, and all of that. Enough test has to be done. Correct?
And gut
Because again,
microbiome also?
see, we'll tell you what we need. But then, if we don't fix it, you are going towards a heart transplant, which is not easy. But if you fix it, you come out healthy.
Okay. Okay.
We
Right.
will make you healthy. You are young. You don't need any such thing.
Thank you. Doctor, one more question. So I have been suffering from hypothyroidism also for many years. So recently I got my anti-TPO test done, and it is the level of anti-TPO is positive 33. So can we rule out that this is hypothyroidism or Hashimoto's?
It is Hashimoto. It does not mean hypo. We need to look at T3 and T4.
T3 and T4 is normal as per conventional values.
You are not hypo, you are autoimmune. Hashimoto.
Acha. Okay. I'm Hashimoto's. But I don't have any sensitivities to gluten or anything.
No.
Really?
Sometimes it's more of a intuition based. Sometimes it's more hardcore data based. We have to see, right?
Okay. Can high levels of TSH cause deficiency in the heart pumping? Because this was my history, which was
High level of autoimmunity, not TSH. Immune problem can cause high TSH. Immune problem can cause poor mitochondria. Poor mitochondria can cause poor muscle of the heart.
Okay. I got it, sir. I got it. Okay. Fine. Let your team let me know the cost of 3 months program later.
Yeah, Resma, I will connect with you tomorrow.
Okay, no problem. Thank you so much, doctor.
Thank you so much, sir.
Thank you, everyone. Thank you, Dr. Meera. Thank you,
Thank you so much.
Anwar Sheikh Saab. Thank you.
Thank you, sir. Yeah.